Hello, everyone. Welcome to episode 42 of Lump Basics, or Basic TCM and Acupuncture. Let's welcome our first presenter, Ma'am Neets Yu, certified acupuncturist. Good afternoon, Ma'am Neets.
Good afternoon, Dr. Hector. Good afternoon, everyone. So the topic for today is OnePoint Therapy for pain. Day 2 na po tayo. Okay? Ang question, how does one use point therapy? OnePoint therapy. So the ideal way to use it is to first treat the pain locally or acupoint and energetically. So sometimes you will use needles or cupping or electrical stimulation, etc. So after removing the local needles, when the patient has no more needles on the body, then make the patient sit or lie comfortably before using your single needle. Okay, remember po. So the 1-point needle should be placed on the affected side. For pain in the left leg, place needle on the left arm. Okay, and vibrated as constantly as possible with pauses lasting a few seconds while the patient moves the affected limb very slowly. Okay, you can control the pain relief by asking the patient how severe the pain. So, yung gauge niya ay 1 to 10. Tatanungin yung patient. The maximum drop in pain will be in the first half minute. Then the pain will continue to diminish slowly over the next 2 minutes. Okay. You can then remove the one needle. Okay. This treatment could be done each time the patient comes at the end of the session. Okay. It works best in pains of an excessive nature, yung yin excess or yang excess. Okay. After each session, the patient will feel greatly improved, but some of the pain will return. 5 to 6 sessions of 1-point therapy would be enough, and then the pain should be treated with some tonification of the opposite polarity. For instance, if you have been sedating the yang of the large intestine meridian a few times, you should then do some yin tonification to finish off. Okay? 1-point therapy works on the principle of the superficial energy circulation. Sedation of 1-point sedates the energy in the meridian of the sedated point and in the meridian of its same polarity in the arm or leg or in the meridian in front of it in the organ clock. So, okay, alam nyo dapat yung ano yung organ clock. For instance, say you have a backache of the excess nature because of trying to lift weight or because of a sports injury. This pain of the urinary bladder meridian would respond to sedation of SI7, but if the backache started suddenly after exposure to cold, this would only respond to kidney 5 sedation, okay? In this relationship, a young excess in the urinary bladder can be sedated in 2 ways besides direct sedation on the meridian. One, sedate the small intestine meridian, yung arm meridian, the same polarity, okay? Number 2, sedate the kidney meridian. It is the meridian in front of the organ clock, which could block it and cause an excess. So sedating it will unblock flow on the superficial energy circulation. You can screenshot po para ma-remember nyo. Or a blocked nose could be treated with one sedation of Li4 and would respond if it was because of an allergy, which is yang cause, okay? Number 2, sedation of the spleen 5, the same polarity leg meridian, if it was due to excessive dampness, which is a yin cause, okay? So, every meridian has 2 possibilities of sedation other than direct sedation on its own meridian. However, this is not true in the case of 3 meridians, yung large intestine, small intestine, and triple warmer. This is because their same polarity meridians and the meridians before them are the same. Therefore, pains along large intestine meridian can only be treated with sedation of the stomach meridian. Remember po, pains along the small intestine meridian are treated with sedation of the bladder meridian, and pains along the triple warmer meridian are treated with sedation of the gallbladder meridian. Remember po nyo yan, okay? Thank you very much for your attention.
Thank you very much, Ma'am Neets. We now come to the second presentation. Let's welcome Ma'am Teresita Sumile for tongue coating, part 2.
Good afternoon po, everyone. Good afternoon, Dr. Hector. Now let's talk about thin yellow coating. This is an indication for the presence of wind heat pathogenic factor. This is often seen in common cold, hay fever, sinusitis, and such upper respiratory infections. Wind elimination points in this area is point gallbladder 20 in the case of cold and sinusitis. Can be used with wind elimination sedation needle technique to eliminate this wind heat. Okay. Next is thick yellow coating. Shows retention of food or stool with heat symptoms. For instance, if the patient feels fullness of the stomach with reflux of food and acid, with bad breath and thick yellow coating of tongue, they should be treated with stomach-yang sedation, with which the retention will disappear. Next is slimy yellow coating. It shows damp heat and is common in conditions such as gastritis, colitis, bronchitis, and cystitis. In these cases, the yang needs to be sedated or eliminated by bleeding the back-shoe points of the organs, and the dampness needs to be circulated with points stomach 40, UV 20, and such to improve the spleen function. Next is dry yellow coating. This shows a combination of dryness and heat, which is more common in the presence of heat attacking an organ and consuming the yin. It is not quite correct to name this an exterior factor because there is a definite damage to the interior organ energy, causing lasting effect. This is when one should say the exterior pathogenic factor has moved to the interior. So the yang should be sedated or eliminated here, but the yin should also be tonified. Gray or blue coating. Gray or blue color anywhere on the face or tongue is a sign of kidney deficiency in either yin or yang. When it appears on the tongue, it is not entirely correct to call this a coating, but it does seem to be more superficial than indeed. The color seems to vary slightly according to the skin color of the different races. For instance, the coating is more gray in Chinese but more black in Africans and Asians and blue or even brown. A dry tongue with gray coating would mean kidney yin deficiency. A moist tongue with gray or blue coating would rather indicate a yang deficiency. Next is peeled coating. It appears like islands without coating on the tongue. It shows dry pathogenic factor affecting the body. A normal tongue should have a thin coating and some roughness. When the coating is missing in areas and we can see the smooth tongue under this, it is called a geographical tongue. However, this dryness is quite exogenous and not serious and can be corrected very rapidly, sometimes in half a day. Next is no coating. This is far more serious than peeled coating. It shows either great dryness of the interior or anemia. If it is pale and endogenous far heat of triple warmer when it is red. Thank you so much for your attention.
Thank you very much, Ma'am Teresita. Let's continue our discussion with diagnosis. We have a clinical example, fibromyalgia, female, 52 years. Okay, a woman came with pain in the neck and both shoulders and some wandering pains in the back, hips, and elbows. Her main problem was with the neck and shoulders. Pain was constant, somewhat better in the second half of the day. So that means towards the afternoon, evening, and in the warmer climate. Always worse during the early hours of the mornings. So she gets up from bed as she cannot lie anymore. Often she has an occipital headache on getting up, which works its way out in the afternoons. Her neck mobility is poor in the mornings, but improves as the day goes on. The above example is a typical case of fibromyalgia and damp wind pains. The patient was large in her upper body, had a swollen appearance in her neck and shoulders. Pressure on the painful areas hurt very much. So this is very excess. And she could not tolerate even a shoulder bag strap on her shoulders. Her face, hands, ankles, and feet also had slight edema. It was evident that the patient's biggest problem was with the dampness, which seemed to stagnate around her neck and shoulders, became worse after long hours of sleep because there was less functional qi to circulate the dampness, and the stiffness and pain improved after longer hours of movement. The warm weather helped but did not completely alleviate the pain, so it was not a cold pain. Where was the dampness originating from? Maybe she was eating too many milk products and refined carbohydrates and sweets. She needed to cut out fatty foods, milk products, and raw foods and refined starches. The organ that generates internal dampness is the spleen, and anything that slows down its function of circulation or that increases thick fluids in the body will also cause damp stagnation in the spleen. Having advised the patient about her diet, her dampness was treated with the following points: spleen 9, which is called the Lasix point; stomach 40, Luo point; bladder 20, Bakshu point, to improve the functional qi, and to descend and eliminate the dampness through urination. Many needles were given locally in the neck and the shoulders, followed by cupping massage to move the thick fluid around. After the first session, she mentioned that she felt lighter in this region and could move freely. After 10 weekly sessions, she was extremely well, most of her pains gone, even the ones in the rest of the body that she was not treated for. Do you think this result would have been possible if only her neck and shoulders were treated with local and distal points? So it is a good idea to treat the problem and the person, for which a case history and examination is very important. We practice energy balancing therapy. To do this successfully, we need a diagnosis of which imbalance is in which organ or meridian. So a good treatment follows a good diagnosis, and a good diagnosis follows a good consultation with the patient. Let us do it together. Thank you for your attention. Let's listen once again to Ma'am Teresita Sumile for the earth element, diseases and symptoms. Good afternoon ulit, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Now let's talk about diabetes mellitus, a disease of spleen, pancreas. Diabetes mellitus is fast becoming very common both in the West and in the developing countries. Eating fast food, preserved food, comfort eating, substituting food for many other human needs are all reasons why our digestive system is under great stress. Though food is given much importance in our lives, most people do not sit down for meals most of the time. Many start the day without breakfast. They tend to eat too much in the evenings because they can eat with the family or relax at this time. Food is necessary for energy, and most of this we need during the day. No breakfast in the morning means no fuel for energy during the day. Our stomach has its best functioning time in the morning. Stomach time is 7 to 9 a.m. Spleen is 9 to 11 a.m. We should eat our energy-providing meal at this time, when the stomach can digest it and the spleen can absorb all of it and provide the body with the energy of all day long. But if we eat our largest meal at night, it not only means that we do not need all this energy in bed, but it also means our stomach will retain all the food and start working on it only the next morning. That means we are full and uncomfortable all night and not hungry in the morning. When we like when we live like this over a period of time, the spleen and stomach suffer chi deficiency. We carry over our parents' habits and their imbalances into our lives. If they suffer from spleen functional deficiencies that are genetically passed on to us, then we can develop juvenile diabetes. If poor eating habits and weight problems decrease our spleen pancreas function, then we can develop a low adult onset diabetes. Now we have type 1 juvenile onset diabetes. Signs and symptoms are thin or undernourished, insulin dependent, increased thirst and urination, hunger and rapid weight loss, quickly exhausted, severe, acute, and difficult to stabilize blood sugar level on insulin. Treatment, liver 13, UB20, Mu and Shook point of the spleen, spleen 2, stomach 41, tonification points, REN 12, stomach 21, stomach 36, local and C points, pericardium 6, area distal point, gallbladder 20, endocrine point. If urinary symptoms, UB23, kidney 7, avoid refined carbohydrates, add lentils or proteins, sprouts or various beans, regular moderate exercise, and aim to stabilize blood sugar with insulin. Then we have type 2 diabetes, adult onset diabetes. Signs and symptoms, obese abdominal or edematous symptoms of stagnation, poor insulin utilization, increased night urination and constant thirst could result then difficulty losing weight, chronic fatigue, chronic slow progressing, decreased immunity, poorly in healing wounds, and vision changes. Treatment, UB20, Shook point of the spleen, spleen 1, stomach 36, to tonify young, REN 12, use moxa, pericardium 6, area distal point, GB20, endocrine point, and then if urinary symptoms, use UB23 and kidney 7. Reduce carbohydrates as much as possible. Animal proteins, vegetable, potatoes with skin, moderate exercise, and aim to improve function without medication. Diabetes insipidus has symptoms of excessive thirst and frequent excessive urination, causing dehydration. It is not a problem of the pancreas, but caused by pituitary dysfunction. This is considered to be a leakage from the kidneys in TCM, as the kidneys seem to lose the ability to hold and store water for the body. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Up next is Therapeutic Methods by Ma'am Lynn Galarita. Good afternoon, Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. We're on our third part on topic therapeutic methods. So for today, we'll discuss about reducing, the second method. So what is reducing? One, it is to dispel pathogenic factors and remove stagnation to help restore body resistance. Second, it is indicated for excess syndromes. Third, it is for excessive and strong pathogenic factors. For reducing excessive and strong pathogenic factors should be eliminated first. And it is also used in if there is fullness that should be relieved. Reducing is also used in blood stagnation, where it can be treated by bleeding. Nawala yung slides, Doc.
Andiyan po yung slides.
Okay po, nag-dim lang po. Okay. How to use reducing method. One, for dispelling wind to relieve exterior syndrome. The points to use are GB20 and LI4. So in invasion of pathogenic wind, the treatment principle is release the exterior and remove the obstruction from the channels. The first point to use is GB20, or the wind pull acupuncture point. It is the most important point for headaches and dizziness, no matter what etiology or channels are involved. It is the major point for wind. So how to locate this point? Below the occiput, midway between Do16 and GB12, and hollow between sternocleidomastoid and trapezius muscles. It's located close to the base of the skull. This point is normally located at the most tender point of the hollow. It is punctured obliquely inferior in the direction of the channel, 1 to 1.5 soon, directed toward the tip of the nose, contralateral to the eyeball or bintang, 0.5 to 1 tune. Caution should be observed in deeper needling as it may damage the spinal cord. Next point is LI4, the joining valley acupuncture point. LI4 is a very popular acupuncture point. It is most commonly used point for analgesia. It's the main point to release exterior and expel wind heat. And it is a very important revival point. LI4 is also the UN source point of the large intestine channel and the command point of the face, nose, mouth, and jaw. So, locate this point with thumb and index finger part. It is found slightly to and the second metacarpal bones. It is needled with perpendicular insertion, 0.5 to 1 tune. Needling this point, we can expect a sensation of local discomfort and soreness. Both acupuncture and moxibustion on this point are contraindicated during pregnancy. So next, reducing is also used for promoting defecation and reducing teeth. For this, we use LI11, stomach 25, and stomach 40. So one condition to use this is to treat heat in the large intestine. Among its symptoms are constipation with dry stools, burning sensation in the mouth, dry tongue, burning and swelling in the anus, scanty dark urine. The tongue will present with thick yellow or brown or black and dry coating. The pulse will be full and rapid. Key symptoms for this is dry stools, burning sensation in the anus, and the thick yellow dry coating. So let's go to the points. First, LI11. It is the best point for chronic constipation. It's the fuzzy point of the large intestine channel. So it is good for any stomach issues. So locating this point, when the elbow is flexed, the point is in the depression at the lateral end of the transverse cubital crease midway between lung 5 and the lateral epicondyle of the humerus. This point is punctured perpendicularly 1 to 1.5 soon. Next point is stomach 25, or the frontal point of the large intestine. It's also called the heaven's pivot. It is the most important point for intestinal disorders. To locate this point on the abdomen, tooth tune lateral to the umbilicus. This tooth tune line of the abdomen is located halfway between the umbilicus and the palpable lateral border of the rectus abdominis muscle. It is needled with perpendicular insertion 1 to 1.52. Caution should be observed in thin patients, as deep needling may penetrate the peritoneal cavity. Next point is stomach 30. This is the most important point to resolve phlegm. So look how to locate this point on the lower leg. It is 8 tune above the lateral malleolus of the ankle and 1 tune lateral to stomach 38. It's basically midway between the tibia femoral joint line and the prominence of the lateral malleolus. So sa kalagitnaan. Its perpendicular or oblique insertion is done here 1 to 1.52. The reducing method is used for invigorating blood circulation and removing blood stasis. Corresponding points are pricked to bleed to treat blood stagnation. So among the signs of blood stagnation are cold limbs, varicose veins, painful legs, headaches, chest pains, liver spots, lack of skin luster, and can find purple tongue with dark spots. Reducing is also used for removing indigestion. The points to use are CV11, stomach 36, and Sifong. Reducing method is not applicable to deficiency syndrome or to cases of deficiency complicated with excess syndrome. So let's go to CV11. This point is used to promote digestion and to descend chi. It is 3 tune superior to the umbilicus on the anterior midline. So it's needled perpendicularly 0.8 to 1.5 tune. Caution should be observed in thin patients, as deep needling may penetrate the peritoneal cavity. It is also contraindicated for moxibustion during pregnancy. Next point is stomach 36. Stomach 36 can be both used for reinforcing and reducing method. Okay. We have already discussed this previously on how to locate this point. It is below the knee, 3 tune inferior to stomach 35, 1 finger breadth lateral to anterior crest of the tibia. First, we have to locate GB34. The stomach 36 lies one tune inferior and one finger breadth lateral to anterior crest of the tibia. And then locate one hand breadth below stomach 35. Needling this point is perpendicular insertion 1 to 1.5 tune. For the last point, this is an extra point, sipong. It is used in children to promote digestion. It is used for childhood nutritional impairment and childhood accumulation disorder. These points are located on the palmar surface in the midpoint of the transverse creases of the proximal interphalangeal joints of the index, middle, ring, and little fingers. In most people, two creases will be found at the proximal interphalangeal joints. Sifong or MUE9 is located on the crease which is the most prominent on flexion. So this is all for reducing method. Join us next time for the continuation on the therapeutic methods. Thank you for listening.
Thank you very much, Ma'am Lynn, for the presentation. Let's now go to topic number 6, still on controlling cycle. Let's call on Ma'am Needs You, certified acupuncturist. Good afternoon ulit, Ma'am Needs.
Good afternoon ulit, Doc Hector and everyone. So, controlling cycle na day 5 na tayo. Okay. So, we have here a clinical example. A young couple came with the problem of infertility. She or the female was 32. She had never been pregnant before and was diagnosed as having PCOS or polycystic ovaries with irregular menstrual bleeding about 4 times a year. Okay. Yung lalaki naman, the male was 35, obese, and had a low sperm count. They had been trying for 8 years to have a child. Having tried various therapies without success, they were skeptical but willing to try acupuncture. So, as we all know, ovarian cysts and uterine fibroids are all tumors, considering to be stagnation of dampness. Okay? So, tumors are marine and solid or hard tumors show marine deficiency and heat and are considered to be potentially cancerous. Okay, remember. In the case of soft tumors, this stagnation of dampness in the water element needs yang and qi to circulate and eliminate it. And some of this yang and qi should come in from the earth element. So sa earth element siya. The kidneys have two mothers. The mother organs for the water kidney are lung and large intestine, remember. And the spleen and stomach are the mother organs for reproductive kidney. Okay. So when treating to improve the function of the reproductive system, we should always make sure that the earth element functions well and has sufficient warmth. Alam, mainit, okay? So ang ibig sabihin na infertility is to fail to become pregnant, poor erection sa lalaki, low sperm motility. These are all symptoms of yang and qi deficiency in the reproductive kidney. So this kidney yang depends on urinary bladder and stomach for its yang. Okay. So this is the picture. Spleen, earth, spleen, stomach controls over the water. Okay. Okay po. Yun yung kanina. So the treatment for the female, bladder 23 and 28, back shoe point of the kidney and bladder. Needle and cupping yung pwede yung gamitin. Then 6, use moxa, the move point of urinary bladder. Stomach 29 for local point, okay? Stomach 40 is the low connecting point for the stomach. It removes stagnation of dampness. Kidney 3, earth point, it takes in yang from the stomach. Bladder 58, which is the low point of urinary bladder, removes stagnation. Sometimes alternated with bladder 67, which is tonification point, okay? After 3 sessions a month for 6 months, the woman's period became more regular. at around every 35 to 42 days. She conceived within a year. Okay. After the baby, her periods were normal but she had problems conceiving again. So gusto niya uling magkaanak. The same points were repeated for 3 sessions in 1 month. She became pregnant the second time. Okay? Sa treatment naman ng male, the man was treated for 10 sessions, given nearly daily for 1 course. His points were the same as given in male fertility. The treatment was not repeated again. You have so far been reading examples of deficiencies on one side of the controlling cycle, causing lack of control on the other side. Sometimes it is not a deficiency, but just a block, okay? Where the energy from one side cannot get to the other side. In this case, it is a simple point, the grandmother point, that will unblock the energy and make it flow through. For instance, in the case of infertility, it would have been, okay, sufficient to give point kidney 3, the earth point, in order to get yang flowing into the kidneys from the stomach. Okay, understand na lang. It would not have been necessary to tonify stomach yang, okay? In the earlier case natin sa asthma sa winter, it would have been enough to use point lang 10, the 5 point of the lung, to increase its yang. If the small intestine and triple warmer had normal yang, it would not be necessary to tonify these organs at all. Okay? All meridians have a special point, which is the grandmother point, which can increase the opposite polarity in them. They will work if there is energy in the grandmother organ. Okay? Just as there are problems of insufficient control when there is a deficiency, there is also a problem of excessive control if there is an excess. Okay? Thank you for your attention, everyone.
Thank you very much, Ma'am Needs. I'm sure maraming natutunan ng mga attendees natin. Let's call once again Ma'am Lynn Galarita for Meridian Theory. Good afternoon po ulit, Ma'am Lynn.
Good afternoon ulit. So we're on the 5th part of the triple warmer channel of hand Shaoyang. So for today, let's continue palpating, pressing, and observing the triple warmer channel. Pain, tightness, or nodules around triple burner or triple warmer 5 may indicate invasion by external wind heat in the Shaoyang channel. Symptoms may include wind heat exterior patterns, headache, redness in the eyes, including pink eye, tinnitus, or even sudden deafness. Nodules can often be found around triple burner 5 in cases of upper shoulder or back pain involving the Shaoyang channel. Meanwhile, the area around triple burner 6 and 7 is important in diagnosis. Chronic conditions that involve triple burner function begin to show as one moves up the channel. Pain or shallow nodules in this area indicate qi constraint in the Shaoyang. This is a more serious condition than qi stagnation, which is reflected diagnostically around triple burner 2 and triple burner 3. Symptoms may include pain throughout the body, constipation, irregular or painful menses, vaginal discharge, or the variety of symptoms associated with the ministerial fire. Okay. Here is the point location for triple burners 6 and 7. Triple burner 6 is located 3 chun above the transverse crease of the dorsal wrist crease between the ulna and the radius. Triple burner 7 is at the level also of triple burner 6, 3 chun above the transverse dorsal wrist crease, in the depression between the ulnar and the extensor digitorum communis muscle. Okay. Next po. So moving on to the next point, triple burner 8 and triple burner 9 will often show tenderness and or nodules where there are problems with lymph circulation. This may include infection or swelling in nodes in the armpit, neck, or throat. In addition, because triple burner 8 is a meeting point for the sinew channels of the three arm yang channels, namely the large intestine, small intestine, and the triple burner, there may be notable tightness in this area when a musculoskeletal condition is affecting all three arm yang channels. This may be seen, for example, in some types of facial paralysis or problems with numbness, weakness, or pain in the upper extremities. Triple warmer 4 is located fortune from the dorsal wrist crease in the depression between the radius and on the radial side of the exterior digitorum communis muscle. So to summarize, for triple burner 5, when there are nodules, we expect a Shaoyang type of upper back and shoulder pain. If there is pain in this area, there is a wind heat invasion and may have also shallow nodules. For if there is sharp pain in triple burner 4, there is a systemic yang deficiency. Nodules and problems. Nodules in triple burner 8 and 9 indicates problems with lymphatic circulation. If there is pain in this area, it's an indication that there is inflammation or swelling in lymph nodes or ministerial fire heat. Tightness in triple burner 8 and 9, tightness or thickness indicates musculoskeletal problems, often affecting multiple yang channels, sinew groups. Pain on triple burner 6 and 7 indicates a ministerial fire type systemic heat. Shallow nodules in this area indicates chi constraints affecting circulation of the triple burner. The area of the nodules may be quite large along the channel path. Meanwhile, tenderness in triple burner 2 and 3 indicates chi stagnation affecting pathways of the Shaoyang channel, that's the shoulder, neck, and the low back, or it could indicate heat affecting yang channels in the head. So this caps our presentation for the triple warmer meridian. Thank you for listening.
Thank you very much, Ma'am Lynn. Looking forward for more presentations on the Meridian Theory. We now come to our last topic for today. We are still on Western differentiation of chest painful obstruction syndrome. Let's talk about pericarditis. So this irritation of the pericardium causes chest pain, which is predominantly felt behind the sternum or just under the nipple, usually the left, and may radiate to the shoulder or over the area of the trapezius muscle. Pain intensifies when lying supine, whereas bending forward can ease the pain. It may be associated with fever. Now let's go to non-cardiopulmonary causes. Hiatus hernia and gastroesophageal reflux disease. This is a common condition that acupuncturists are likely to see often in practice. It consists of the protrusion of the upper part of the stomach through the diaphragm into the thoracic cavity. This can cause chest pain. The pain is directly on the sternum and is elicited by swallowing or stooping. The pain may radiate to the region under the ribs or the space between the shoulder blades. There is also nausea, belching, and hiccups. It is important in practice to differentiate a chest pain of this type from those caused by the heart or lungs. These types of pain usually arise after eating a full meal and may be intensified by some postures like bending forward or lying supine. Carcinoma of esophagus. This is more common in men over 40. It causes pain on the sternum, typically aggravated by swallowing. There is also excessive salivation, poor digestion, debility, and loss of weight. The lymph nodes in the neck may be enlarged. Chest wall pain. Musculoskeletal conditions such as rib fractures and muscle tears or herpes zoster infections of the chest wall are other important causes of chest pain. So the former conditions are characterized by increase of pain when you palpate the painful area, very often well localized by the patient himself, whereas those chest pains caused by infections will be characterized by burning in pain, which follows the dermatomes. So we're talking about herpes zoster, with usually without crossing the midline. Pain may develop before the onset of the syndrome-related cutaneous manifestations. A red flag in Western medicine. Chinese medicine treatment of chest pain, either chronic or of recent onset, must always be preceded by a correct diagnosis based on Western medicine. Thank you very much for your attention. We hope to see you again in our next presentation. Thank you.